Go ahead.
All right, Jason, I think we're live. Am I kicking us off?
Yep.
All right, good afternoon, audience, and welcome to the presentation today. I have the pleasure of hearing me. I'm Chris Johnson, Vice President of Revenue Cycle Management with Atrium Health. Been there for about 24 years and kind of all things revenue cycle. And I have the opportunity of working with Jason and his team on the AI work and the project that we're doing. And Jason, I'll throw it to you to introduce yourself.
Sure. My name is Jason Petrosich. Been working in revenue cycle for 25 plus years, managing business offices in some national locations with multiple offices, multi-hospital systems. So my background is really kind of from the business side of what we're going to present to you today, not necessarily the tech side, although I think Chris will share some of the details of what we've been able to accomplish.
All right.
All right, and so with that, I'll jump in and talk about the first few slides that we've got here. So we wanted to share with you our journey. So between Atrium and Medwit, I'm going to talk a little bit about what are the values and the needs that we're seeing as a business, right? And so some of these are translatable to all industries, not necessarily healthcare specific, but that's our particular focus. But I think that we can kind of create some information for you that will help you make some decisions about where you go with your journey forward in looking at automation and AI and NLP for that. So the things that we're going to cover today is kind of what AI means to RevCycle. What our patients, need to perceive excellent service, right? And that really is translatable to all industries. What is good for using AI and robotic process automation and what's not good for that? And then how do we bring all that together and actually deliver value back to the organization and not just have some, kind of pie in the sky ideal of it would be great if we could do this. We want to actually deliver value back to the organizations. So we'll start with what do we need AI for in RevCycle? RevCycle is a very people-intensive business, a very lot of back office processes that most patients who come in the front door of a hospital or the front door of a doctor's office don't ever see. A lot of electronic EDI going back and forth between providers and payers, a lot of paper going back and forth between providers and payers and faxes. I think the healthcare industry is single-handedly keeping the fax machine in existence right now. But we're very manual, right? And so that just inherently creates a lot of repetitive work that people are asked to do in their daily jobs every day. So when we look at tools, the AI kind of suite of tools that are available, those are really, able to help us get through more of that back office busy work faster, right? We can get through larger quantities of data. We can take the repetitive stuff and take that, through automation and get that done so that the employees don't have to do that same step over and over again, and really kind of elevate those employees to a higher level of contribution to the organization. You pay people for their experience to solve problems, and that's really what you want them to do. You don't want them pushing paper around the desk every day. It's not really a good challenge for them. So specifically when we kind of talk about the area of patient service and interaction with health systems, hospital systems, such as Atrium, there are a lot of questions. It's not as black and white as, you go on a website and you're going to buy something, you go on Amazon, you know exactly what you're paying, you know exactly when it's going to be delivered. There's not really any question about how much you're being charged, right? It's clear. If you don't like it, you don't press the button. In healthcare, you have a lot of customers who didn't necessarily choose to have the service. Obviously, if they got an illness or if they were in an accident, came in through the emergency department, so they're kind of thrown into owing this bill and having this financial interaction with the provider. That wasn't always necessarily their choice. Now I know the industry is moving towards being patient friendly and doing estimates and trying to help kind of overcome that hurdle, but really, just in the day-to-day work of interacting with our patients, there's a lot of questions. And the industry itself is changing, with more payers shifting responsibility of copays, high dollar deductibles to the patient. Patients owe more of a portion of the balance than they used to 10 years ago, right? It used to be the insurance paid, most of everything, and you might have had a copay or co-insurance, but it was pretty straightforward. Now there's a lot of complex exceptions and things to the rule that have to be explained to our patients. And then we also have a new regulation that took effect this year for no surprise billing, which is kind of good for the industry, but adds another layer of complexity of communicating what you owe and why you owe it to that patient, and following the explanations and the rules that are set out for that explanation. So that's kind of the needs. And now the opportunity here really is that, the current generation of consumer, they largely want no contact resolutions, right? They want to shoot somebody a text message and ask a question, and they don't want an immediate conversation. They don't want to have a conversation with somebody. They want their answer, and if that comes back an hour later, that's fine. Or if they get asked a question back and they respond later, that's like asynchronous, right? So there's no like commitment to immediately pay attention to this. I'll get to it when I get to it, but I still get my answer, right? So there's this interesting kind of flexibility of, we want to provide great service, but we can't always do it with a phone call, right? And that's kind of the old school way. So looking at the new technologies that are out there actually opens doors for using automation. We'll talk a little bit about some of where we're going with that a little bit later in the session. But that really opens the opportunity to use technology to help facilitate those interactions through the process. So that's kind of the need. Just looking at some statistics from the industry. I'm not going to read all of these out loud. You can kind of see what they look like on the slides here. I think the gist of all of these stats really says that consumers, as much as ever, they want a company that can communicate well with them, right, and can engage with them, and can solve their problems, right? And so, one of the things that you think about is the perception of your company through customer interaction, right? And in healthcare, there's actually kind of a split interaction. So you have the clinical, where somebody is face-to-face with their doctor or their clinician, and they're having that engagement, and they can have satisfaction or dissatisfaction with that particular process. But then the financial interaction is a completely separate part of the business. The clinical people rarely talk to the business office people. They're just kind of almost in two different worlds. But those can significantly impact that perceived experience that the customer has with the organization. They could have the best doctor. They could love their doctor and say, this is the best doctor I've ever had in my life. I would recommend him to anybody. And then they could get a bill that's garbled or doesn't explain, or they try to ask a question and they don't get a good answer, or they don't get a response. And the financial side can ruin that customer service. So as a healthcare organization, it's very important to focus on meeting that need, so that we can ensure that we're doing our part in keeping that experience to the highest level possible with that particular patient. Now, I mentioned kind of some of the changing and evolving technology. This is a research study that I grabbed off of Salesforce, but it's really kind of interesting because it shows the color green dots over on the right are essentially age, right? The pale one is the baby boomers, and the dark one is the millennials. So you can see that most of those are shifting to the right for the tech, and shifting neutral or shifting to the left for kind of in-person, like real-time interactions. And I think it's really, illustrative of where organizations need to evolve to. If you're still running a heavily phone-based patient contact center, obviously that is going to decline. It's going to continue to decline over the next few years, and you're going to have to introduce these other technologies in order to meet the needs of those patients who want that asynchronous communication, with them, but still have that high level of explanation and solution to their particular issues. So when we kind of connect those together, we think about what are the things that happen over and over again that are candidates for automation. Anything that's repetitive. In a call center world or a patient contact center where you're taking emails in or chats in or texts in, you get the same type of request over and over again. And that's where we're going to be going with Atrium, and Chris will share a little bit of that in a second. But so from a technology perspective, there's a couple components to that. One is really understanding what is that request. And this is where some of our natural language processing can come in. Can you take free text speech, whether that's written or spoken, and translate that into what is the meaning of the request that this particular patient is making of us for our customer contact center. And that's the sentiment analysis and really understanding, are they calling because they're upset? Are they calling to ask a question? Are they happy? What is the content of those particular requests that are coming through? And that's the interesting, challenging part from an AI perspective. There's been a ton of work in solving those problems and making those things reusable and plugging them in. But so in our industry, healthcare is very unique. You get unique questions that don't apply to other industries. But we can use the same tools that are available in order to help understand and classify those requests. And then the next step is to actually connect that with automation. So, Chris will talk about an example of requesting a itemized bill, but that's something that happens over and over again, where I can identify what that request is that the patient is making of us, route that into the automation to complete that task. And there's dozens of things that happen that are very similar, but when you get thousands of calls a day, then that really can add up in the potential value. So that's kind of the overview of where I think AI is and how it relates to call center interactions. Chris is going to talk a little bit about Atrium's experience with automation and where we're going from there.
All right, Jason. Thanks for that. And now we'll share with you guys. So Jason shared a lot of information about some industry trends and what we're seeing there with customer expectations. So we're going to shift a little bit. I actually want to spend a few minutes talking about where we at Atrium are bringing this together and having some really good initial success, and we think that's going to continue to grow. So and I will do my best not to read slides to you, but kind of try to fill in. So I expect that our experience is very similar to that of most providers. Even though we work continuously with our health literacy folks on written communication and the information that we're sending out to our patients, we continue to expand our self-service options, trying to put more ability in the hands of our patients to self-serve on questions that they have about their statements, their bills, or any other factors. But even with all of that, we are continuing to see the number of patient inquiries grow. And so even though we have these other alternatives, we try to divert some of this. The number of inquiries is continuing to climb. And I suspect that like most of the people in the audience, we are having difficulty in finding skilled teammates that can handle the complexity of the the job that customer service specifically and some of the other functions have turned into. And even when we can find them, no surprise, I'm sure you're all facing the very same thing. Those skill sets are expensive when we can find them. So we're all getting hit by that. We're all chasing that same goal. And this has given us an alternative to help maybe win a little bit or at least make some inroads to that battle. Um, so next slide, Jason. So when we talk about where does AI fit in into the overall puzzle, as Jason alluded to, and this kind of points out, AI really fits and works where there's a lot of volume, and where you're doing repetitive tasks, doing the same task over and over. And so logically, it fits where you've got high workloads. In our experience, I'll talk a little bit about this in more detail, but it's also for us been where we looked in areas where there's a lot of backlog, and we're like, so what's creating the backlog? And a lot of times, quite honestly, the backlog is created by simply not having enough human resources to get through all of that work. So this is kind of where it fits in. Additionally, AI can be trained to learn repetitive processes and replicate them through, the RPA process. And another thing that I'll talk a little bit more about is this shift to electronic channels. So we've got requests coming from patients from all different channels. I mean, they call us on the phone, they send us emails, they go through my chart. We're in Epic Shop, so we've got inquiries and questions coming from our patients from with multiple channels. So as we're going through this journey, our hope is, and what we're finding is that AI can help us triage and actually route some of this incoming patient requests. And ultimately, what that does is it'll make our teammates more efficient. And I'm going to talk a little bit about what the shift that we're seeing in teammate interaction and teammate expectations. So let's break that down a little bit to the real world experience. So we've been working with Meduit for about a year in this AI journey to automate repetitive back office tasks, and I've got some of the initial results on there. We have been very pleased in some of the initial results that we're seeing. So on processes that we've automated, and again, when we said, okay, well, what can we automate? We didn't start with customer service. We kind of started with where's there a lot of volume in work queues specifically, and where are there backlogs. And we said, okay, let's test this and see how it works. And you can see, I mean, these are real numbers or real achievements that we've been able to make in those particular processes. And so and I hope I made that clear. And I'll talk about that a little more, but we do a process at a time. We're not tackling 300 different things at one time. We really take a process, learn from it, move to the next, and try to keep learning. But in what we've been able to automate so far, we've seen about 60% reduction in the human work per that per that task that we've automated. The other piece that was really important to us, we didn't expect to see a difference in ultimate outcome of an account resolution between whether or not it was a teammate that did the work or whether it was the AI bot that did the work. But like most providers, we're a little anal retentive, so we actually pursued further down the path. We did a look back to say, okay, if this account or this issue or the work queue issue, if it was resolved by the bot, did we actually ultimately get paid? Again, we didn't expect there to be a difference because outcomes should be the same. But the good news is we validated that. I mean, we've got a 90+% success rate in getting the claim paid after it was in fact worked by the bot or worked through the automation. Um, we've learned throughout the course of the year how to move pretty quickly. The first one was hard, so no denying that. We had to, all figure out what the best process was, and we are still learning that. But we've really gotten it down to let's identify, let's observe, let's document, let's come together with a team, and then okay, can we make automation work here? Yes, develop it, test it, and ultimately move it into productivity. Um, and this point about flexibility to change in business needs, there are some areas where we started in our journey and we said, well, wow, we think this would be good, and this is where we should put some resources. But as we've learned more, and we've gotten smarter in working with the Meduit team, we've stepped back and said, maybe there are bigger opportunities somewhere else. It's not that we don't want to automate this particular function, but let's come back to it because we think there are larger opportunities in some other area. So, based on this initial success, we really the one thing I do want to share with you, I'll talk a little bit more about this, is the energy or the synergy we're seeing in our team as we start to expand this in the revenue cycle and we start to get buy-in from the teammates. Wow, this really can help us with the ever increasing volume that we have, and it can make me more efficient, and it can make our process work more quickly. So far, very very positive results. Next slide, Jason. So, as Jason mentioned earlier, we are a pretty large system and growing pretty rapidly. So you can see, again, I won't read all these to you. You can see we have a number of points of entry for patients. Our call center, customer service call center, we average about 4,000 calls a day, and we receive about 500 requests per day via some type of electronic, whether it's email or through it's my chart through the portal. Um, One thing that we'll share with the audience, um, when we fully implemented my chart, we actually saw that our inquiries, our questions, our requests for itemized bills and those kind of things, we actually saw that number almost double. Um, and so, honestly, for us, it was kind of a good news, bad news situation. Um, the good news was we put a mechanism out there for our patients to ask questions and try to, get more information about their services, about their bills and so forth. And that's what we should be doing. I'm not arguing that. I'll tell you the bad news for us is it's kind of like we put the offer out there and they took us up on it, right? It's kind of like build it and they will come. Well, we threw it out there, and let me tell you, the patients responded and started sending a lot of requests. And so I share that to say the timing of some of the automation that we're doing could not be better because we simply can't staff up fast enough to keep up with some of the volume. Um, Next slide, Jason. So, based on the success rates I shared with you, some of the earlier processes that we automated, we really believe that customer service is kind of the ideal next step for the use of AI. And again, here's some of the reasons. And this is just one example of an area that we're focused on. For a provider, any provider, the request for an itemized bill or an itemized or a detailed bill is a very common request. I think most organizations don't send out by default detailed itemized bills because all of us as providers know those can be pretty lengthy and very expensive to mail out. But we communicate over and over and over that if you want one, all you have to do is ask, and we'll be glad to send that out. Um, so they can be generated sent to the patient from our patient accounting system, but that doesn't happen automatically, right? There's a series of steps and decision points that occur to actually make the process of getting that itemized bill into the hands of the patient a multi-step process. And so in phase one of this use in customer service, really it's our goal to train the RPA to complete the task and kind of generate the itemized bill. And so, very simply, and I'll talk a little bit more about savings. We kind of talked about the 60% reduction in labor time or labor expense a little earlier on the things that we've been able to automate. In this case, if we believe if we can automate this and get the same results that we're seeing on some of the other work, that's the equivalent of initial savings of one FTE for us in our shop. So again, very, very, very positive outcomes for that. I do wanted to take just a minute and to throw this out there because I know when people start talking about AI and automation, one of the questions that immediately comes up from the team is, okay, well, am I going to be worked out of a job? And I will tell you at Atrium, our approach to the use of AI is not to reduce our labor force. Quite frankly, we don't have enough, right? So it's not our goal to reduce our labor force. It is our goal to use AI to allow our people to work at the top of their skill set, to do the more complex things, and to allow us to absorb the increase in volume we're gaining through mergers and acquisitions and just a growing organization. So we've been able to successfully share that message with our team. And again, I think we're being successful there. It's not our goal to drive down our FTE count at this point. Kind of phase two in this is for HRMS to introduce natural language processing to really understand and react to common phraseology that comes through free text. And as you can see from the slide, this type of automation can quickly reduce labor costs. And again, one thing that we potentially could automate would be the equivalent of one FTE worth of labor savings. Next slide, Jason. So we think this, yes, it's only the tip of the iceberg. We really believe from what we're seeing that we're just beginning to see the benefits of AI. One of the best outcomes of achieving some of these early successes is that our team is now becoming a promoter of the technology. They're now asking, well, if it can add A and B and get C, well, maybe it can do this, and then maybe it can do this, and maybe it can do this. And that's been very encouraging to see that type of buy-in from the teammates. So next slide. Oh, I'm sorry, you're already there. So what's the future plan? And so where are we going? For us, we really see it as continuous iteration. We see, the bullet points really kind of explain this. Complete one task, tackle the next. Again, we didn't say, okay, let's throw 100 things up on the board and then let's just, tackle them all at one time. We really took a more measured approach and said, let's build, let's get a success, let's go to the next one. What we do see happening now, though, is because we took that approach, our our time between implementing new processes is getting shorter and shorter and shorter because our team is used to the process. And this third bullet point where it says iteration should be sprints measured in weeks, it's really proving to be true. Again, the first one was hard. We debated, we measured, we documented, et cetera, et cetera. We're getting better at that. Again, don't try to solve all the processes at the same time, but focus on the tasks that are going to bring you the most value and the ones that you can execute quickly. Um, Ultimately, here's what we want to do. Um, and this slide says it, better service every day. I mean, we believe that if we can do this in incremental steps, it is going to allow us to continue to improve our customer service and the services that our teammates are providing every day. Um, this third bullet point is when I really want to focus on where it talks about backlogs will quickly decrease. And Jason can validate this and speak to it. Several of the processes that we automated, we had run backlogs in those work queues for months upon months upon months. And going through the process of doing the observation, doing the research, mapping out the plan, and then implementing and moving it into production, um, we saw those backlogs decrease to a reasonable level that the team can now manage in a matter of days. It's just simply amazing to watch what happened in some of those cases. Um, so again, it's been a good experience and a big win for us. Next slide, Jason.
That's it. I think we're
Oh,
ready
well,
for
let me make
questions in the last
sure.
couple minutes.
Oh, Jason, one thing, then again, probably keep it my slide. Sorry about that.
Yeah.
One thing I do want to go back and restate our goal, just as a reminder. Our goal is not to use automation or AI to reduce our staff. And I think that's where we're getting a lot of buy-in, but it's really to allow us to take on a fast growing volume without having to largely grow a labor force with a lot more FTEs. And again, initial results show that I think we're going to be able to do that. So either of us are glad to answer any questions. If you want to put them in the chat, anything that we could share with you, we'd certainly be glad to do in the last minute, 15 seconds.
Yeah. Drop your questions in the chat. Um, as Chris said, it's definitely a journey. The biggest takeaway, from the tech side is don't try to solve everything at once. Focus on a couple key things that are going to deliver you value. Get those done. That helps get the buy-in from your employees, your stakeholders, around the organization. If you got one win, then it's much easier to go get the next win than trying to kind of pitch this, hey, let's boil the ocean and fix everything at once. And it's more manageable, right? You'll get more satisfaction from the exercise of employing this kind of technology in your organization if you do get those quick wins in place.
Absolutely. Jason, I don't see any questions in the chat, but I see a message from Audrey that the next session is on its way. So I tell you what, we'll give you 19 seconds to jump over there. Thank you guys for attending. Hope that you got something out of the presentation.
Yeah, thanks everybody.